Hi everybody, I'm Raj Mago. I'm here with Dr. Jack Krasuski, who is Executive Director of the American Physician Institute. And Dr. Krasuski is here in Philadelphia to do a lecture about suicide prevention, and we are very glad, Dr. Krasuski, that you agreed to speak to us and give us some tips about suicide assessment.
Yeah, well, thank you, Raj. I always like an opportunity to kind of spread the word about things that we can do as clinicians to improve the way we assess people at suicidal risk and then manage them. Obviously, it's such a serious problem. We know that the suicide rates have been increasing now for the last 15 years or so. So this is a very timely topic. So thanks for the opportunity.
You talked, Jack, about the fallacy of prediction in relation to suicide. What do you mean by the fallacy of prediction?
Right, so there's a huge conundrum that we face as clinicians, and that is that we cannot predict suicide. By that I mean we cannot identify which individuals will proceed to die by suicide, and certainly we cannot predict when they will do it. And yet society at large kind of believes that we can predict.
Right.
And malpractice plaintiff attorneys try to present to the court that we should be able to predict
For
suicide.
one particular person.
For one particular person. And yet the data does not support this. Over and over, the data shows that we cannot predict suicide, which individuals will proceed to suicide. And all the experts agree that this is not possible.
Right. So the clinicians shouldn't really put pressure on themselves, and we should try our best, but we should realize that it is not possible to be 100% certain for a particular patient whether this particular person will or will not commit suicide. You can never be 100% sure.
Yeah, you can never be 100% sure. And the reason for this is that because based on how common suicidal risk factors are, and they're very common, and I'll give you some statistics just to highlight this point.
Yeah.
So suicidal risk factors are very common, and yet suicide itself has a low base rate. So to put it in a more provocative way, suicide is rare, while suicidal risk factors are common.
Right.
And it's really like trying to identify the needle in the haystack. So let me put this in perspective.
Yeah.
So in the year of 2014,
Yeah.
there were 42,773 people that we know that died by suicide in the United States.
Okay.
42,773.
Right.
All right. Certainly a lot of people.
Yeah.
A large societal tragedy.
Too many.
Too many. And so now keep that number in mind, and yet at that same year, there were about 1.1 million suicide attempts. So that means for every person who died by suicide,
Yeah.
there were about 25 attempts.
Right.
Now we're not done. Epidemiological surveys in that same year suggest that 9.4 million people endorsed or had serious suicidal thoughts. 9.4 million.
Yeah.
That's over 220, people endorsing serious
Right.
suicidal thoughts for every person who proceeds to suicide. So that's what I mean. The suicidal risk factors are very common. When you think about 9.4 million people, that's around 3% of our entire population.
Yeah.
9.4 million with
Right.
thoughts, 1.1 with attempts, and a little short of 43,000 who actually died by suicide.
Right. Right. So it's hard to know out of the 10 million people which one of them is actually going to kill themselves.
That's right. And so, a person can say, well, we can develop better instruments, predictive instruments, better rating scales, or maybe some blood tests, or, brain scans or something like that. But I'm not very optimistic that in the near future we're going to really be able to identify which individuals will proceed to suicide. And the reason is because when there's a low base rate of a condition, the positive predictive value of any kind of instrument is going to be low. That means there will be many people who are false positives, and they will swamp the number of people who will be true positives, meaning the people who will then proceed to suicide. So it has to do, again, this conundrum of our inability to predict has to do with the commonality of the risk factors together with the low base rate of suicide itself.